The Nintendo Wii is increasingly being used in rehab settings to improve range of motion, functional strength, and balance in patients recovering from stroke. The results of Wii therapy are encouraging. Patients experience tangible gains in their ability to function independently in basic activities of daily life, such as self-care, and they can see an increase in their ability to participate in social and leisure activities. Most importantly, Wii therapy is fun. When patients enjoy therapy, they stick with it longer and see greater results. The patient and therapist choose one of the Wii sports options: tennis, golf, baseball, boxing, or bowling, based upon the movement pattern and range of motion desired for the patient. Here, the patient expresses an interest in bowling as a meaningful activity and finds a comfortable and effective grasp on the Wii control, ensuring that the wristband is secure. If the patient is just beginning therapy, there are modifications available. For example, in Wii bowling, a new patient may begin the activity while sitting, and the less affected upper extremity can be used to help guide the more affected side through the desired motion. The therapist can also help guide the affected arm through the desired range of motion as the patient begins therapy. Here, the patient is seated while playing Wii bowling and uses his unaffected arm to guide his affected arm through the bowling range of motion. The patient's back is supported by the chair, and he has both feet on the floor for maximum stability during this initial phase of Wii therapy. As the patient progresses, seeing increases in range of motion, strength, and endurance, the patient may stand while playing Wii bowling. Here, the patient is using his unaffected arm to hold onto a chair for added stability. The chair is placed slightly in front of him, and he uses a staggered stance for maximum stability. As the patient continues to make gains in range of motion, strength, endurance, and balance, he can continue to progress as he plays Wii bowling. Here, the patient is standing without assistance and weight shifting as he moves his affected arm through the bowling motion. Notice the increases in range of motion and speed. These increases suggest that he's experiencing greater strength and endurance, especially on the side affected by stroke. Notice also the benefits he's gained in balance and in lower extremity function. After a Wii therapy session, patient and therapist can follow up with an activity that relates to functional aspects of a patient's daily life. Here, in the therapy clinic's kitchen, the patient prepares to make a meal using his affected arm to gather the necessary items. Wii therapy can be geared towards most phases of stroke rehabilitation, and it produces tangible results that translate into other areas of a patient's daily life. Most importantly, patients are more likely to stick with Wii therapy because it's fun,